Taj Khan. So I have great experience in performing laser tattoo removal. And here we are with our patient. I'm going to perform a laser tattoo removal on his left arm. And when I got involved with this technology and this procedure some years ago, I purchased the absolute best technology and laser on the market. So Alice, if you could just show the laser here. The big box is a lot of energy, and that's what you want for laser tattoo removal, because tattoo ink is meant to be permanent, and now we're trying to reverse it in several months with some sessions here. Alright, so I already dialed in. I have my settings all ready for him. This is his first session. I have 15 millimeter spot size. I always put the safety eyewear on. And we'll just start here. He has this larger tattoo here on the arm. I just like to be consistent with the treatment. And we're going to fire just a pretty quick rate here. Okay? So you can see this on the side here, Allison?
Mm-hmm.
And we're at 10 pulses per second. There you go. Okay. Here we go. So you can see how quickly it goes, 10 pulses per second. It's a very efficient process, so you can just see how it's nicely, the tattoo ink is nicely being absorbed by the laser energy. Keep moving here across the back very nicely. And I always like to be very consistent and very thorough with making sure that the spots overlap so that every single area of the tattoo ink is being treated. How are you doing so far? Okay? Mm-hmm. All right, he's good. He's a great patient. And he has absolutely no numbing anesthetic in right now. But I have to say, he's probably more of an exception when it comes to comfort level, because most patients do feel this pretty much. And you can use some numbing anesthetic injection that I can give prior to the treatment. And patients typically like to have that. It all depends on your level, your threshold for comfort, or pain, essentially. All right. Did you want to get this little shadow here?
Yeah.
Okay. So that's the great thing about this laser is I just try to pinpoint exactly where I want to go. So right here he has this area where he wants to leave the tattoo next to it. So I'll just go as much as I can, and you can see how I can avoid certain areas very strategically with my tongue depressor. All right, and I'm just going to keep moving here so we can get the rest of the tattoo. So he has a large tattoo. The majority of patients, you know, I'd say on average, the tattoos are much smaller than this. But, you know, this is a tattoo he's wanted to remove for a while, and that's why we're doing it today. So he's doing absolutely great. We're going to keep moving here. And he'll need several sessions for this. You know, I tell my patients 90% of tattoos are removed in about 6 to 12 sessions. And then the other 5% are less than 6 sessions, and then the trailing end, the other 5%, are 12 sessions or more. And I remove tattoos in as little as 3 sessions, but I typically don't tell my patients that because I don't want them to expect that. So I usually tell you 6 to 12 sessions if you want complete removal. A lot of patients come in and they want simply to camouflage the area. So then I can just do it in as little as 3 sessions, fade the tattoo, they can go back to their tattoo artist and then re-ink over it so it looks like a proper tattoo. So thank you for tuning in. You can take a look at the arm once again. This is a great reaction he's had. You can see how the ink has absorbed the laser tattoo energy very well. He would keep this very well moisturized with Aquaphor for a few days and put some sterile dressing on it as it's healing up. And then he'd come back in about 4 to 6 weeks to do the next session. I just ask that he be consistent with coming in for his sessions, because then those patients that follow up like that, they usually have the best results. So thank you for tuning in and hope to see you soon.